Let's talk lungs with Trent and Lori from Lung Saskatchewan. Dedicated to connecting you with lung health experts and key opinion leaders who will share current, evidence-based lung health information to inspire you and those you care for to take your best breath. This podcast is recorded on Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, Nakota Sioux, as well as the territory of the Métis.
On this episode of Let's Talk Lungs, we will be having a conversation with Lung Saskatchewan nurses and respiratory educators Jill Hubick and Jaimie Peters. Jill is a registered nurse and certified respiratory educator and is the manager of community care and education for Lung Saskatchewan. Jaimie is also a registered nurse and certified respiratory educator and is the manager of community care and home oxygen for Lung Saskatchewan.
This episode of Let's Talk Lungs is sponsored in part by Sask Energy. Sask Energy is proud to support communities in Saskatchewan through unique partnerships, sponsorships, and community events. To find out more, visit saskenergy.com.
Well, thanks for joining us today for today's episode, Jill and Jaimie. Then the tables have turned a bit, Jill. A host of this show, you're now our guest today, so thank you for being part of this episode.
I'm excited to be here. Thanks, Trent.
Now, growing up on the prairies, all I seem to remember about summer was blue skies, lots of sun, maybe a rainy day or two in the mix. But over the last many years, it does feel like that is changing in terms of summer air quality. Now, this season in particular has been particularly dry on the prairies, windy, and we're unfortunately seeing unprecedented numbers of wildfires. The devastation is all too real for the many that are on evacuation alerts or have been forced to evacuate. So we are so grateful you're both here to talk about wildfires and the subsequent smoke that is changing our summer air quality. Really curious about learning about how we can prepare and protect ourselves during a wildfire season. But before we get into the topic today, I smell smoke and how to protect ourselves from that wildfire air, we want to talk about certified respiratory educator. It sounds impressive. Jaimie, what is a certified respiratory educator and how can they help someone?
Thanks, Trent. A certified respiratory educator, which we shorten to CRE often, is a health professional with specialized training in COPD, asthma, and chronic disease education. Many different professions can be a CRE. They range from respiratory therapy, nursing, physiotherapy, pharmacy, or even exercise therapists.
So where would someone go to find a certified respiratory educator or CRE like you and Jill?
Sure, CREs are found throughout the community. Some you'll find in the health authority, all throughout the province. Some work in pharmacies, some work in community clinics or other programs just like Lung Sask. You can find a current list right on our website at lungsask.ca.
Okay, Jill, it's your turn. Talk to us about wildfires. It does seem like over the past many summers, there are more and more days that are hazy and the air quality is poor. Is this actually happening, or has it always been the case, and are we only noticing it now?
We certainly have always had wildfires. However, with climate change, we see these wildfires intensify. So what we mean by that is it's getting warmer, the temperature is going up, and with that, we're seeing more dry conditions, more drought conditions. So the wildfires are larger in size and they burn longer. And unfortunately, when we see that happen, that's when we have more smoke, more air pollution, and as a result, we see worsening of health symptoms and more severe symptoms from the smoke.
Can you talk to us a little bit about harm? Where is the harm in breathing in wildfire smoke?
When we think about our lungs, let's think about them as the internal filter, if you will, to the outside world. So our lungs are really only meant to breathe in clean, fresh air. When we breathe in something harmful, such as smoke, the effects on our health vary. It really depends on every individual. Everyone's a little bit different, and the effects can be mild or they can be rather severe. But we can look at certain populations and realize that certain populations are more at risk. So for example, if you're really small, our little ones in the world have smaller airways. They have smaller lungs, and their lungs and airways are still developing. They also breathe at a much faster rate. So, with that, they tend to breathe in more smoke. And when our lungs are still developing and we're exposed to things like air pollution and smoke, there's risk of damage. Then on the other side of the spectrum, our older populations tend to have at least one underlying health condition. They might even have more than one. And we know that smoke is a common trigger to make underlying health conditions worse.
Well, I certainly know how I feel waking up on a smoky morning. Even before I've stepped a foot outside, I can tell that there's smoke in the air. So, Jill, what kinds of symptoms would a person expect if breathing in wildfire smoke?
Exactly. It really does affect all of us because we all have lungs. And sometimes our symptoms can be mild, things like a little bit of a headache. Maybe our allergy symptoms are worse. Maybe we have a runny nose or itchy eyes. Or if you're someone living with a lung condition like asthma or COPD, we tend to see people experience worsening shortness of breath, worsening cough. Uh, their chest might feel tight, like an elephant is sitting on their chest. Or they might wheeze, which is a whistling sound from the muscles around the airways tightening. And then, certainly in some conditions like COPD, we may see more mucus production and they may be coughing up phlegm. And all in all, people just don't feel well when there's smoke in the air.
All right, we're going to take a short break and get right back to our conversation with Lung Sask nurses and respiratory educators Jill and Jaimie. Lung Saskatchewan has long been associated with leadership in lung health education. Whether you enjoy watching a webinar, a video, reading information online or in print, or listening into a podcast like this, Lung Saskatchewan has education to meet your needs. Find out more at lungsask.ca.
Well, welcome back, listeners. We are talking to Lung Saskatchewan nurses and respiratory educators Jill and Jaimie about wildfire smoke and its impact on our lungs and breathing. Jaimie, we just heard from Jill about where the harm is. But what about specifically for people that live with a lung disease like asthma or COPD? How is wildfire smoke harmful to these people?
As Jill mentioned earlier, smoke can affect everyone's health and breathing, but those with lung disease, smoke can cause a worsening of symptoms and cause mild to even severe lung attacks or breathing emergencies that need treatment quite soon.
So, for example, for someone with asthma, COPD, or pulmonary fibrosis, what kinds of additional symptoms might they experience?
Yeah, Jill mentioned a few earlier, including shortness of breath, cough, wheeziness, chest tightness, or increased mucus production. So what we need to know from those symptoms is that it's really important to make sure your lung disease is managed well before forest fire season begins, before the smoke is even there. We've seen already, though, in 2025 that this isn't predictable. So we really need your disease managed well all the time to protect people from having worsening symptoms or a breathing emergency.
So breathing emergency, let's talk about that. And what would be considered an emergency and what should someone do?
For sure. So some of the signs and symptoms of worsening lung disease or getting out of control or out of your lung disease not being well managed may include struggling to breathe or feeling extreme shortness of breath. Someone may feel fatigue or tiredness. Their nostrils might flare. Their skin may turn pale or gray, or even their lips or fingertips might be blue if they're struggling to get enough oxygen. And especially in little kids, you may see them having a really hard time breathing, and you'll see their skin sucking in between their ribs. And this really means you need to get to the emergency room quickly and seek healthcare treatment very quickly. Some people may find it hard to speak, and some may experience themselves not reacting as like they used to their inhaler. So everyone should have a fast-acting reliever inhaler or rescue inhaler. And that inhaler might not be working as it should when we want it to do. So if those things are happening, we want to get to the emergency room or to see a healthcare provider as soon as possible. To prevent this, and if symptoms do worsen, we tell people with lung disease to follow their plan of action provided by their doctor or nurse practitioner or certified respiratory educator. If you don't have a plan of action, you do need to see someone sooner than later to get this plan of action made. These action plans are written directions of what you want to do if your lung disease is worsening or you're having more symptoms. So it might tell you to increase some of your regular medications. It might tell you to add some medications on to help make it through when your symptoms are worsening. So we encourage everyone who doesn't have one to talk to your doctor or nurse practitioner or whoever to get one on hand so you know what to do if you are struggling. We also want people to always take their reliever inhaler or reliever medication, whatever that might be, all the way to the hospital if they have to go. So taking it as you need it so that your lungs react and are being treated all the way to the hospital. If you or someone you love or is experiencing a lung attack or a breathing emergency, you can call 911, hop in an ambulance, or if you're close to the hospital, someone can drive you if it's not too severe at that moment, but never drive yourself.
Okay, Jill, I'm going to toss it back to you. Let's talk a little bit about how to protect ourselves. The Weather Network now publishes an air quality indicator as part of the daily forecast. So can you tell us a little bit more about that and what that information means to us?
Yes, for sure. The Air Quality Health Index is really this awesome tool that we typically have at our fingertips if you have access to your phone, the internet, or a computer. And it's a tool that gives us a scale from 1 to 10. And within that scale, it's measuring the air quality where you're living and breathing. And so it's really important to understand what those levels mean. So 1 to 3 means typically that the air quality is good. It's safe for anyone to be outdoors enjoying their regular activities. From 4 to 6, that's when the air quality is about at a moderate level. And typically we recommend anyone with an underlying condition, such as heart disease or lung disease or those small little ones or older population, to limit their time outside because it may worsen some of their symptoms. It may cause some breathing problems. However, if we see the air quality health index at a higher rate, like 7 and above, this is indicating that there's a lot of air pollution out there. Right now, we're seeing a lot of smoke in Saskatchewan. So we would tell everyone, do whatever you can to avoid the smoke and move all your activities indoors.
Jill, I have a question about masks. Most of us are familiar with the use of many types of masks during the pandemic. So are there some masks that can provide protection on a really hazy day?
That's such a great question. So the short answer is you always want to try and remove yourself from the trigger whenever possible. So the first thing we always advise to people is if you can, stay indoors away from the smoke. But if you absolutely have to be outside, a well-fitted N95 medical mask will help protect you from some of the larger particles. So what that means is it can help with some of the irritation you might feel in your nose and in your throat. However, it won't completely protect your lungs and your airways from the smoke. So it's an option if you absolutely have to be outside. But again, if the air quality is poor, if the air quality health index is saying, hey, it's a 7 and above, come on inside if you can.
Okay, well, on that note, let's talk a little bit about being inside. Jaimie, what about indoor air quality on days where wildfire smoke is really bad? What kinds of things can we do to protect our indoor air quality?
For sure. Thanks, Lori. So really important things to do while you're staying inside is to ensure that the doors and windows are always kept shut and, sealed up as much as possible. We want to make sure that if you have an air conditioner, that you're using it on the recirculation setting so that outside air isn't being pulled inside to, make your indoor air quality worse. If you have or are able to purchase an air cleaner or an air purifier with a HEPA filter in it, this can help your home or your workspace as well. You just need to make sure that that air cleaner is the adequate size for the space that you want it clean. You may want to, of course, never smoke inside the house or burn anything inside the house because that can make the indoor air quality even worse as well. If you do have to go somewhere, we want to encourage you to keep your windows and vents closed while you're driving. You can turn your air conditioner on in your car as well and use that recirculate setting so you're not bringing in the outdoor air inside your car as much. And of course, we're telling you to stay inside over and over again. This is really important because we need to stay away from the thing that is affecting us most, the smoke. And so, of course, don't have any other burning going on, like bonfires or backyard burning, so that you can prevent the air quality from even getting worse.
Jill, we talked a little bit about wildfire smoke and how it can be particularly bothersome for people that live with asthma and COPD. But let's talk a little bit about the other things that all people can do to protect themselves.
For sure. So the first thing is understand what the air quality is like around you. Look at that air quality health index and adjust accordingly. That would be the first thing. If you have an underlying condition, make sure your medications are up to date. Jaimie did a wonderful job talking about the importance of having an action plan. So know what to do if you start to experience symptoms. That may be adding medication or increasing your dose so you feel better. If you don't have an underlying condition, but you start to experience severe breathing difficulties or chest pain, for example, or just feel really, really unwell, seek medical help for sure. And lastly, I think it's important for people to realize that smoke really can irritate allergies. And allergies are super common. And then on the flip side, people living with a lung condition such as asthma or COPD often have allergies. And the allergies, if they're not controlled, can make their lung condition not controlled. So treat the allergies too, not just the lung condition. That may involve speaking to a healthcare provider, such as a doctor or nurse practitioner, to see, hey, would a prescription nasal spray help me, help open up the airways in the nose to get me breathing a little bit better? Would an over-the-counter non-drowsy allergy medication help? These are all things that can help us feel well and feel better.
Well, Jill, let's talk about feeling better. And one of the things that many of us do is exercise to feel better. What precautions should we be taking when we're exercising during a wildfire season? Certain exercises, we know we breathe faster and deeper. So what should we be considering?
Well, I know many people listening, like me, probably want to be outside as much as they can when it's beautiful, when it's hot, when it's not minus 40 in Saskatchewan. And we want to move our exercise outdoors, whether that means going for a walk or going for a run. But unfortunately, if their quality is poor, we really do say, hey, move your exercising activities indoors. And if you're indoors exercising and you're still not feeling well, take a moment and wait until you feel better. Do not resume your exercise until you start to feel well again. The other thing that we can all do is hydrate. If we're dehydrated, we're already putting stress on our bodies. And then if we're exposed to poor air quality, we're adding to the stress. So those are some things that we can do. And then remember as well, hey, warm up before you start your exercise. See how you feel in the warm up. If you don't feel well, maybe it's time that you stop until you feel well again. Cool down properly. And then if you do have a lung condition, carry your reliever or rescue medication with you at all times, especially when you're exercising.
That's great advice, Jill. Thank you so much. Jaimie, we're getting to the end of our show, but before we leave, can you share with us where people can go if they have more questions about how wildfire smoke might be affecting them?
Thanks for hosting today, Lori and Trent. Such an important topic and timely topic. If you want to learn more about forest fire smoke and how it can affect your lungs, please check out Lung Sask website at www.lungsask.ca, or you can call our Lung Sask helpline at 1-833-385-5864 and speak directly to Jill or myself if you're struggling to breathe this forest fire season. We're always willing to help you and try and help you manage your lung disease better.
Well, that's a wrap. Jill and Jaimie, thank you so much for joining us for this episode. We sincerely appreciate you both, the important work you do to support the people of our province living with lung disease or facing threats to their lung health, and appreciate you both for making time to be with us today on Let's Talk Lungs.
Thanks for listening. If you enjoyed this episode and you'd like to help support Lung Sask's Let's Talk Lungs podcast, please share it with others. Post about it on social media. Like, subscribe, hit that notification bell for new episodes, and leave us a review. Follow Lung Sask on Instagram @LungSask and on X @LungSask. That's all for this episode. See you next time. Produced at Sound Lounge by T-Bone.